So, hello everybody, good evening, and thank you very much for joining us tonight. My name's Katie Reeve. I'm one of the equine nutritionists here at Dengie. Before I introduce our guest speaker for this evening, I'll just go through the plan and a bit of admin and kind of what the arrangements are for tonight. So as always, this webinar is being recorded and it should be available on our Dengie YouTube channel in the next week or so. There are lots of other recordings from previous webinars on there, so do go and check those out if you've not seen those already. And to help with the quality of the recordings, we have got the audience cameras and microphones switched off for the duration of the session. But if you have any questions, please just pop them in the Q&A box. We've got my colleague, Dr. Katie Williams, who's the Technical Product Development Manager here at Dengie. See her on camera there. She's also joining us this evening. So between all of us, we'll be able to answer some of the questions behind the scenes as we go. But we should also have some time for questions at the end of the session as well. So that leads me on to introduce our fantastic guest speaker for this evening. We're very excited to have her with us tonight. So Professor Jacqui Matthews, she firstly qualified as a veterinary surgeon before completing her PhD in parasitology at the University of Glasgow. During her first lectureship at Glasgow, she embarked on a journey into the world of horseworms to develop modern techniques to understand more about these complex parasites. Over the next 25 years in academia, she conducted numerous research projects examining sheep, cattle and horseworms, whilst also teaching at 3 of the UK's vet schools. Jacqui's research has generated more than 150 published papers, and she's authored numerous articles, given seminars, and for many years she was the parasitology expert on the UK Veterinary Products Committee. She's also a member of several subgroups of the CANTER initiative, which stands for the Controlling Antiparasitic Resistance in Equines Responsibly. And this was set up to develop and promote best practice guidelines for worm control in horses. And I think she's possibly going to share a little bit more about this later on this evening. And one of Jacqui's inventions was actually a diagnostic blood test for the equine small red worm. And this was taken on by Austin Davis Biologics in 2019. And from 2022, Jacqui moved to this company as their Director of Veterinary Science, where she leads the research and development program supporting the use of innovative diagnostics for evidence-based worm control to improve the health of our horses. So I don't think there's anyone better placed to give us an update really on kind of where we're at with worm resistance in horse parasites and all the things that we can do as horse owners to try and avoid that further selection for worm resistance on our yards. So without further ado, thank you very much, Jacqui. I shall hand over to you to share your screen.
Thanks, Katie. I must remember to send a shorter biography to people when they ask for one, so you don't have to bore everyone on a Wednesday night with all that information.
It's all very impressive stuff, so it's great.
Anyhow, what we're really here is to talk about horseworms. So I'm just going to take you a trot through a bit of a background to parasites that horses are exposed to at grazing, and then some of the things that we can do not only to control these parasites, but also to try and mitigate the increasing challenge of worm resistance. So tonight I'll be covering the worms and the wormers, as well as resistance, and then hopefully provide you with some solutions for sustainable control of these parasites of horses. I'm sure many of you are aware that horses can be infected with a whole range of different types of worms. This slide just gives a summary of the main actors in that particular area. These worms here that are all like little curly worms are actually small red worm or cyatostomans, and this image just shows you some larval stages in the gut wall of a horse. And horses can have burdens up to several million worms of these parasites, which, as you can imagine, can lead to clinical disease. The lovely worms in the flasks are Anapocephala perfoliata. These are tapeworms. Actually, I usually say to people, if I don't have a picture, they kind of look like conchiglie pasta when they're fresh. It's just that they're in saline solution because that's us making some antigen for the ELISA assay there. So that's why they're nice little baths. And then up here, we have pinworm eggs on the top left-hand corner. These are the eggs that get released onto the horse's skin by the female worms, and when the horse scratches, they can be spread in the environment. These resistant shells. I won't be talking too much about pinworm tonight, but I'm sure I'll have questions. This is an ascarid egg. This is a Parascaris species, as an important worm of foals. And it has a really interesting life cycle. It goes through the liver and lungs, and then the adults live in the small intestine. And the female adult worms, which are like spaghetti. I hope no one had pasta for dinner tonight. It's a bit of pasta. I did, but anyway, I don't mind. They're like these spaghetti or noodle-like worms, and the females can release millions of worms. And this is a third stage larva. You won't see these with the naked eye, but these are the parasites stages that are on paddocks that your horses pick up and become infected with. They're tiny. They're only about 100 microns long. So that's an introduction to the worms. The most important worms that affect horses, not just in the UK, but worldwide, are the cyathostomes, also known as small red worms. Most horses grazing are affected by these parasites, and they do affect animals of all ages. However, younger horses are more likely to have higher burdens of these parasites and are therefore more prone to develop disease due to the presence of small red worm. The disease that we usually see that's caused by very high burdens of small red worms is known as larval cyathostomonosis, and that really involves the emergence of many encysted larvae, as you see here down in the right hand corner, from the gut wall. And when they emerge in massive numbers, tens, hundreds of thousands of worms, they can cause a syndrome known as a protein losing enteropathy. And basically that makes the gut very leaky and not able to function properly, and you end up as in this case, a horse with severe diarrhea. And unfortunately, horses that develop the syndrome, about 50% of them die in severe outbreaks. So it's something that we want to avoid. The cyathostomes themselves are a complex group of about 50 different species, but most horses have a small group of the common species, with 3 to 5 very common species found. But as far as we are aware, the different species within the small red worm or cyathostomen group, they have a sort of similar life biology. It's just that they live in different places of the gut and they look a bit different to each other. The life cycle I'll show you in a minute. There's a phase in the horse, and then there's a phase in the environment. And the most important point from tonight's point of view is that resistance to wormers is really very common in small red worm. This little infographic just shows you the life cycle of the parasite in the horse. These are the infective third stage larvae, which I showed you earlier, are picked up from paddocks. Horses eat them from contaminated paddocks. They scoot up down the esophagus, through the stomach, through the small intestine, and then into the large intestine. And there they go into the gut wall and go through these encysted larval stages, which go through 3 main phases. While they're in this encysted phase, they molt to the 4th stage larva, which emerges from the gut wall into the lumen or tube of the gut to become adults. And the male and females mate, and the females release eggs. It's what we pick up in dung. And these are strongyle eggs that you would see in a fecal egg count test if you were to take a sample from an infected horse. Within the dung, these eggs hatch and they release little larvae called 1st stage larvae, and then they undergo a molt to 2nd stage larvae, and then they undergo a final molt to the L3 to start the life cycle again. And it's those L3 are very fast. They move very quickly in a plane of water. That was an L3 larva, by the way. To make their way out away from the fecal pad to at least several feet from the dung pile on the paddock. So that's why it's really important that we remove dung from paddocks to stop these eggs getting to the stage where they can hatch and the L3 coming out. As far as we know from research, we know that in the UK, the eggs can develop through to that infective L3 in as short as 1 to 2 weeks in the summer. And that's why we advise that you should remove dung at least once a week. And we know that high paddock infections can then lead to a build-up of these encysted stages in the gut wall as the horses consume many larvae from the grass, and that if we don't apply pasture hygiene methods, then many worms can develop. This is the guts of a horse that unfortunately died due to larval cyathostomonosis, and each little brown spot there, I hope you can see, is an encysted larva, and that horse probably had several million worms. This cartoon just explains those larval phases in more detail. What we think is that the larvae accumulate in the gut wall, particularly in young animals, as they develop immune response to these worms as they come in from after ingestion. And the immune response seems to slow them down in their development. And this is why we think, and particularly in horses about 1 to 5 years old, they can accumulate large numbers of encysted larvae because they don't fully stop the parasite in its life cycle. They just act to slow it down, and then the worms can accumulate in large numbers. And we don't really know what the triggers are, but in some horses, many worms then synchronously emerge at once, and that's when we see the clinical syndrome of larval cyathostomonosis. The further complexity in the whole situation is that the different stages of cyathostomin or small red worm parasites are susceptible in different ways to the different wormers that we have available, with only moxidectin and the 5-day fenbendazole regime shown to have efficacy against these stages within the gut wall. And we do know that there's a lot of resistance around against fenbendazole in small red worm, and that can reduce the effectiveness of that 5-day regime against these insisted stages. So for many years, people like myself advise that all horses should receive an annual treatment of moxidectin in order to target these stages, because we couldn't measure them by fecal egg counts, because there's no relationship by the numbers of these worms in the horse and egg counts. Now, the good news is that over time, animals do develop immunity to these parasites. So in a healthy adult population of horses, say 5 years and over, many of those horses will have a small worm burden, particularly if they're on clean paddocks. And we call that the 80-20 rule, where only 20% of the horses on a given paddock will shed 80% of the eggs at any one time. Obviously, in younger horses that are more susceptible to infection, the 80-20 rule doesn't apply quite so clearly, with higher egg shedding in more individuals. However, if we're going to base our wormer applications on the basis of fecal egg counts, this means that we don't need to worm all the horses to influence pasture contamination. We just have to identify those guys that are shedding the most eggs. And this little infographic from one of our papers a couple of years ago just gives us a demonstration of that. So you can imagine this is a group of adult horses or healthy horses on a field, and only those horses in light grey are horses that shed higher levels of eggs, for example, over 200 eggs per gram of dung, and all the other majority of the population either are shedding no or low numbers of eggs. And in order to impact the contamination on the paddock, we just target those high egg shedders, and that means we can substantially reduce the use of our wormers, which reduces the risk of resistance development. The other important worm that we get in horses is the tapeworm, Anaphila perfoliata. It lives at the junction between the small and large intestine, and it's a bit more different from small red worm in that some populations of horses, there's a low prevalence of this parasite, as low as 10% or less, but in other populations we have higher levels of infection, over 80%. All ages of animals are susceptible to these worms, but they think younger animals might be more susceptible to developing larger burdens. Importantly, tapeworm can cause colic in horses, and we know that only over 20 tapeworms can cause quite severe damage to the intestinal lining, and that puts them at a higher risk of colic. And work done in the 1990s showed that the higher the burden of tapeworm you have in an individual horse, the greater the risk of it developing colic. Now, these are different to small red worm. They are hermaphrodite worms. These kind of conchigally shaped ones are hermaphrodites, and they produce segments from behind their head that mature as they're pushed back further by new segments being generated. And in these segments are the male and female organs, and these male and female organs then fertilize, and you end up with these big packets of eggs within segments. But we do know in many infections in horses, they either contain lots of immature worms, which don't contain the egg packets, or they comprise sterile worms, which don't contain the egg packets. And that means that fecal egg count analysis for tapeworm infections is not very sensitive. This is just the life cycle. And the important thing to remember that's different from the small red worm is they have an intermediate host. This has an indirect life cycle. And what that means is this little mite, the Euripetid mite, there's many of them, many families of mites that live on paddocks all over the world. These enter the dung pile, and if they come across an egg, they eat it. And within the mite, the egg develops through some larval stages over the course of 8 to 12 weeks. And then once that larval stage is developed in the mite, if that is eaten serendipitously by a horse, the horse will become infected with the tapeworm as it eats the mite. It's a bit like the old lady that swallowed the fly situation. So the horse swallows the mite that's got the larva breaks out in the intestine and grows to the hermaphrodite adult. The adults we think can live for a long time. So horses, if they're not treated, if they're infected, can be infected for a long time. And we do know that the release of these segments from the fertile tapeworm adult is a bit non-continuous. So you can sometimes miss egg counts in a sample if there's not the release of these segments containing the eggs, even although there may be adults within the intestine of the horse. The mites are everywhere. We can't really control the mites in the environment. What we can do is lift dung to prevent the mites coming into contact with the eggs. What we find from studies done across Europe is that the peak levels of immature worms are in the autumn and winter. And you can imagine why that might be. If there's more infections in the summer, this is when the mites are most active, horses are infected, and the worms take a wee while to develop through to mature adults. So you tend to have higher levels of immature worms in autumn and winter. And then if they're left untreated, these horses, the worms gradually mature, so you get lots of adults in the spring. And we have to be careful because it's those adults that can release the egg packets, which then can contaminate the paddocks for the mites to come into contact with the eggs and dung. The good news is we've got a diagnostic test for tapeworm to sort of counter the fact that egg count testing is insensitive for this infection, and that's based on antibody responses to tapeworm antigens or molecules that are released by tapeworms, and that's available, as you probably all know, as a saliva test called Equisal in the UK. And if we look at the over 200,000 tests that we've done so far commercially with Equisal, we can see that only about a third of horses that we test in our labs is positive and is recommended for treatment, with over 2/3 not recommended for treatment. And that's a massive saving in anti-tapeworm wormers by using this test. So very quickly go on to wormers and resistance. So we know that there's only a limited number of wormers for horses, and there are no new wormers in development as far as we're aware from feedback from pharmaceutical companies. For roundworm infections such as small redworm and ascarids, we have the macrocyclic lactone wormers known as ivermectin and moxidectin. We also have benzimidazoles, such as fenbendazole, that are effective against these worms. And we also have tetrahydropyrimidines, such as Pyrantel, which is effective against roundworm. If you use Pyrantel at the double dose, it also has effectiveness against tapeworm. And we also have a specific anti-tapeworm wormer known as praziquantel. So this little cartoon just shows you how resistance is selected in worms. So it's a bit like antibiotics. If you give too much of the drugs, you select worms that are more resistant or less susceptible to the wormer than the population was overall when the wormer was first introduced. And if we keep doing that over time, what we find is we keep selecting these worms that are less susceptible to the drug and their progeny mate, so that the genes that confer resistance to that wormer amplify up in the population, because there are more surviving adults left after every round of treatment. So we want to avoid that, especially as there doesn't seem to be any new wormers coming in the near future. Now, this little table is really quite depressing. Sorry, I'm just moving the camera out the way there. What we find is that depending on the type of common worm that we see, we do have levels of resistance, particularly in small redworm, as I mentioned earlier. Both fenbendazole and Pyrantel resistance is really quite common now in populations in the UK and abroad, particularly with Pyrantel in the United States. And what's been clear over the last decade is we have signs of emerging resistance to both ivermectin and moxidectin. In terms of tapeworm, most worryingly, in the last 2 years, we've seen the emergence of resistance to both Pyrantel and praziquantel reported in tapeworm populations and stud farms in the United States. Large redworm used to be an important worm, but we don't see much of it now because it seems to be particularly sensitive to macrocyclic lactones such as ivermectin and moxidectin. So in horse populations which have been exposed to these drugs previously, which is most horse populations that are managed in the UK, we tend to not find so much large redworm. So we don't know if there's any resistance there because we don't find it with the sensitivity of the test that we've got. The ascarid infection of foals is also concerningly has a lot of resistance, particularly to ivermectin and moxidectin. So it's a bit flip side compared to the small redworms, but we also see reports of resistance emerging to both fenbendazole and Pyrantel. So quite a depressing state of affairs. Now, these practices that select for resistance within a population of worms are exactly as you would imagine from a practical point of view. If you treat horses all the time, all the group regularly, you will select for resistant worms. Just think of the little cartoon I showed you a minute ago. If you underdose horses with wormer, what you tend to do is select even sort of slightly less resistant worms. So you have this sort of bigger selection process going on where you've got very resistant worms, but other worms maybe on the edge of resistance surviving the lower dose. We used to teach dose and move to fresh paddocks, but we don't recommend that anymore, because if you dose a horse with wormer and then you move it to clean paddock, any worms that survive that treatment are going to seed that pasture, and you'll end up with an almost 100% population of worms that are less susceptible than they were before dosing. So we don't do that. And we also obviously We don't recommend that you use a non-licensed product, say a cattle or a sheep product, in horses, because the pharmacokinetics are not optimal, and therefore you get resistant selection as well as effectively underdosing, and you certainly wouldn't use those products by the wrong route. But people do this, so I always put it on my slide. So we seem to be in this perfect storm where we've got common worms and we've got susceptible horses that can obtain lots of these worms and develop disease. But sadly, we have resistance to all the wormers available, developing or quite set in the common worm species that we've got. So we need to avoid a situation where wormers do not work in horses with disease-causing burdens. We don't want to reach that situation. And for that reason, we need to apply more sustainable methods of control. So that means, first of all, we have to implement management practices to reduce that contamination in the environment. So think about those life cycles, think about where the worms are coming out and how long it takes them to develop to the stages where horses can become infected. It's very simple. We lift the dung, we remove those horses' stages of worms in the dung and remove them well away from the paddocks. We can then use tests to identify horses that need worming as well as those that don't need worming. And the tests that are available, as you know, are fecal egg count tests and antibody-based tests. And then we use those results to inform the type of wormer that they need to use and which horses needs treatment. There are some situations, though, however, where testing won't provide all the answers, and we call those strategic worm doses. And they would be, for example, in very young foals with ascarid infections, we would need to give treatments that we would consider would be the most effective anthelmintic, or in horses that have high burdens of encysted larvae that are high risk of disease. Again, we don't really have tests that would tell us about their risk of disease. So in those cases, we would maybe give a larvicidal dose against small red worm larvae. So I'm just going to go through very quickly the sustainable approaches, because 30 minutes goes very quickly when you're talking about worms. So I've mentioned dung removal ad nauseum already, but we do really need to consider doing this in every situation. And I know it can be very difficult for some people, particularly when it's wet and it's cold, but this is really a very effective way to reduce parasite infections within populations of horses. Dung machines that lift dung are better those that sweep, and we certainly don't recommend people to harrow paddocks, because all that does in the UK, where it's pretty cool and wet, it just spreads those worms around and they can survive from 1 year into the next year. So we don't recommend that people do harrowing for parasite control. As you imagine, the more horses you've got on a paddock, the more it can become contaminated over a certain area. So we recommend that people maintain a low stocking density, ideally a maximum of 1 to 2 horses per acre, and prioritise that where young horses are grazing. If you can get even lower densities than that, that would be great. The parasites do eventually die out. The small red worm larvae that develop from eggs deposited in one season aren't able to feed. So they run out of energy reserves usually by the middle of the next summer, because they've used all their food reserves in swimming about like that. So we recommend, if you're going to rest pastures, do it for a prolonged period rather than 2 or 3 weeks. That probably doesn't make much of a difference in terms of reducing third stage larvae. So we would recommend, if you can do that, to rest a paddock for 12 months if you're concerned that it's been heavily contaminated, or at least the first 6 months of the following season to enable the small red worm larvae to die out. We don't really know how long ascarid eggs or the larvae in the orbited mites remain viable for on paddocks. So I tend to say leave them as long as you possibly can to try and reduce the levels of infection of these worms. Another thing you can do is you can use ruminants between horse groups or with horse groups. Probably a sort of a good way to do it from a parasite control perspective is to use ruminants in the first half of the grazing season to try and act like biological hoovers to sweep up those worms that were deposited in the last season, and then you can swap them round with horses mid-season. But you do have to be aware of liver fluke. So if you are considering co-grazing or rotational grazing with ruminants, please do speak to your vet. These are just some studies to show that dung removal does work. I'm just not sitting here on a Wednesday night making it up. These are a couple of the studies that have been done by our group, where we looked at manual versus automated removal, as well as no removal in different fields containing donkeys at the donkey sanctuary. And you can see quite clearly here where you have no dung removal, and this is egg counts. The egg counts go up much, much higher than the egg counts of those donkeys that are grazing paddocks where there's manual or automated dung removal. This is a similar study, but in horses this time, where we looked at egg shedding levels on, these were paddocks, yards of people that just wanted to join our study. They're different yards where they had dung removal. yes, and no dung removal. And what we found is the egg counts in the horses on the yards where there was no dung removal started higher than those on the yards where there was dung removal. And importantly, what we found is after we treated the horses with moxidectin, which is in Equest, we found actually the horses on the paddocks where there was no dung removal, their egg shedding went up faster and significantly higher egg counts, even by just 10 to 12 weeks post-worming. So diagnostic testing is the other important tool that we can use for sustainable worm control. And the cornerstone of diagnostic testing, which I'm sure many of you use now, are fecal egg counts. Now, fecal egg counts are good for detecting and estimating strongyl and acidarid egg shedding and passing in dung, and they can be used to target treatments against these worms and also for testing the effectiveness of wormers. Fecal egg counts aren't so good for estimating a tapeworm burden in horses, but there are now antibody tests available both in blood and saliva formats, which can be used to detect infection with tapeworm to inform worming decisions we recommend in spring and autumn. In horses at a low risk of infection, you can use a blood test, which measures antibodies to small red worm, which can tell you whether or not your horse has a low burden that doesn't require treatment. So if your horse is in a low risk situation, for example, and you think, oh, I should give it moxidectin just in case, you might want to consider doing the blood test just to confirm that you actually don't need to treat that horse and apply selection pressure in treating all horses in the group. There are other tests that are available for detecting large strongyles, which look like small strongyl eggs, but you can do larval culture. And of course, you can do the tape test for pinworm. And there's even an antibody-based test for liver fluke, which is available at the University of Liverpool if you're concerned about horses having liver fluke infection. In terms of fecal egg counts, always remember that fecal egg counts do not correlate with worm burdens. So they don't tell you what is in a horse. They're just telling you what that horse is passing on to paddock. And for that reason, we use fecal egg counts to target wormers to those horses to reduce pasture contamination from horses that are shedding more eggs. You can apply them from 6 months old in foals, and at that stage you can identify the acidarid from the small red worm eggs. And once you start testing foals, you can assess them every 8 to 12 weeks when they're grazing. And it's important to remember that if horses are out all year round, particularly in the mild conditions that are now seem to prevail in the UK, you should also do egg count tests in the winter. We recommend that you wait at least 8 weeks after a benzimidazole, pyrantel or ivermectin treatment before you do your next egg count test, because it might be too soon if you do it before then, and 12 weeks after moxidectin treatment. We did some studies many years ago to look at the variation and variability around egg count testing, because we wanted people, if they were going to do it as well as they could to reduce variation between and within their samples. So these are the recommendations that we came up with. Collecting dung as fresh as possible, obviously, because the eggs might hatch if you don't. Take material from at least three balls across the dung pile, because what we found when we looked at egg counts in different balls in a dung pile, we found there was different numbers of eggs in different balls. So you want to get rid of that over dispersion effect and get better representation. So get at least 3 balls in there and mix it. Collect at least 5 grams. Place it in a labelled sealable bag, or if it's in a wee box, fill it up at least 5 grams, because you don't want air in there, because that can promote egg hatching. And if the samples aren't getting processed immediately, refrigerate them, keep them cool, because that slows down hatching and larval development. And then get them processed as soon as possible when they arrive at the lab. We also recommend that people test the efficacy or effectiveness of their wormers at least once a year, because there's no use in using wormers that don't work. And in the process of efficacy testing, all you do is you take your samples from your horses as your initial screening, as you would do, and then those horses that are over 200 eggs per gram, as measured in the fecal egg count test, you retest them, you treat them and you retest them 2 weeks later. And then the second count, there should be at least a mean reduction in egg count of over 90% within that group of horses that you've tested that were positive with 200 eggs per gram, of over 90% for fenbendazole and pyrantel wormings, and over 95% reduction in egg count after ivermectin and moxidectin wormings. So it's really important that you do that and you ask your fecal egg count test provider if you can do it, or your vet or your SQP if you're not already doing it, because as you can see earlier, a lot of the wormers don't there's resistance to a lot of the wormers already available in horses, and it's important that you test the effectiveness of what you're using. Now, I mentioned earlier that fecal egg counts don't correlate with worm burdens, and antibody tests are available that provide a measure of the level of infection, and that's based upon the fact that antibodies to certain worm molecules have been shown to correlate with the level of worm burden in individuals in initial validation studies. And then we can use this tool method called the ELISA method in the lab, which gives us a readout, and that allows us to estimate the amount of antibody that was correlated with the number of worms in the initial studies. And that readout provides information on the level of burden, and that knowledge of burden allows you then to make a decision on whether or not to worm a specific horse. In terms of tapeworm testing, there's two types of tests available. Your vet can do a blood test, and the samples get sent to us at our lab in Austin Davis, and then we report the test result back to them, and then they recommend treatment depending on the diagnosis that's given from the test. Or you can do a saliva test yourself. You can either get that from your SQP or vet, or buy it direct from us. And again, you have to follow the instructions very clearly for each test to make sure that follow the parameters that we advise, such as leaving the horse for 30 minutes without feeding before you send the sample back. Otherwise, it'll be too dilute because they salivate. And then we will report that result either back to you directly or back to your SQP or vet. And it's very similar. The treatment will then depend on whether the horse has a low, borderline, or moderate high diagnosis. We recommend that people test for tapeworm, particularly in the first instance if you don't know much about the prevalence of tapeworm within an individual group in the spring, because in the spring we know that there are more likely to be higher levels of egg-containing adult worms there, which will produce eggs, which will contaminate the paddocks, and then the mites can come in and eat the eggs. So we recommend that you look at your horses in the spring just to identify horses that might have a burden that's causing contamination. And if you can identify those, you can treat them and prevent that contamination. And we also know from other studies that horses acquire burdens over the summer grazing period and are more likely to have higher burdens in the autumn. And that means that they'll be more at risk of clinical disease. So we recommend that all horses should be tested in autumn in order to identify if they have a burden that requires treatment. And this is just a typical snapshot. We could probably take yards from all the people that are on this call tonight and look at their horses, and this is usually what we find. We usually find that about over 60% of yards have less than 20% of horses positive, so the prevalence is low. So again, we're seeing that sort of 80-20 rule, negative binomial distribution that we see with other types of worms. And then on 93% of yards, less than 50% of horses are positive. And then there's a few yards where we see problems with high levels of prevalence with many horses positive. And that's usually because of poor management. And we can go back, and we often go back and work with the vet or the individual customer to give them some advice about worm control for tapeworm. In the worrying situation, it might be due to resistance to the tapeworm wormers that are available. I mentioned the small red worm blood test earlier on, and as I mentioned, that's to be used in low risk situations. If you want to use a wormer, but you consider that your horse is at low risk of small red worm infection, you can use that small red worm blood test to assess whether or not that horse does have a low worm burden that does not need treatment with a larvicidal wormer. It can be used 4 months after your previous worming treatment, and we recommend that people follow our criteria that are on our website in terms of whether or not to test an individual horse. Again, a low risk horse being those on very clean grazing, an adult horse or a horse with limited time to grazing, and a horse that's had repeated low egg counts, as well as the horses that it grazes with. And this just shows you the use of the small red worm blood test in practice in low risk settings. So here we've got a population of 3 horses on very clean paddocks from which dung removal is removed daily. And we can see that these horses' serum score results in the small red worm blood test rarely go above 1,000 worm burn cutoff. And we've taken, because these horses are in a low risk situation with scrupulous dung removal daily and they're adult healthy horses, we've taken the 10,000 worm burden cutoff to inform treatments. And therefore these horses haven't received any wormer since 2019 when they were first tested. They get tested annually. We also look at a sport horse cohort. These are mostly horses that spend a lot of their time not at grass, and we find if we use a small red worm blood test we find that over 60% of those horses have worm burdens below the 1,000 burden cutoff, and over 80% below the 10,000 burden cutoff. So many of these horses previously would have received a wormer, but now the vets that are working with these horses are using the test to inform the need not to treat these horses and therefore reduce selection pressure for wormer resistance. So I'm just going to finish up now on some sustainable control, and the bottom line of all control methods is where you start. And it's really important that you do a risk assessment, preferably with your prescriber, either your vet, your SQP, or your veterinary pharmacist, to try and work out whether or not your horse needs a wormer or not, and what are the management methods that you should be applying, or to confirm that the management methods that you should be applying are being done, and also to inform the type of tests that you need to use and the frequency of the tests. And we've actually developed, which is coming soon, this is news tonight for everybody on this webinar, a little app or a little online calculator that will help you work out what's your worm risk of your individual horse, which you can discuss with your prescriber to go through the steps in making decisions about wormer use. It also aligns well with the recent canter guidelines, which Katie mentioned, which we launched about almost exactly a month ago just now, which provides all the information that's required in this case at this stage for prescribers in implementing sustainable parasite control in horses. And the risk calculator that we developed was extrapolated from the risk table that I developed with some co-authors on the canter guidelines. These are the sort of questions that you should be going through, and the calculator will help you, either doing it yourself or with your prescriber, go through these various factors that are important in deciding what level of worm risk a horse has. And then the outputs that you get from the risk calculator will help you categorize your horse's low, medium, or high risk. And it will help identify gaps, if they are there, in your worm control, and suggest interventions to improve your worm control, to reduce your wormer risk, and therefore save on wormers, as well as continue to ensure the good health of your horse. Finally, how do we bring all this together? So I've talked about the worms that are there. I've talked about resistance. I've talked about the management methods that we use to try and reduce the levels of worms that are in the environment. And I've talked a bit about the tests that we can use to implement in a sustainable worm control to identify which horses require worming and which horses don't require worming. And I just summarise these here. So just keep in mind that you should be using fecal egg count tests regularly, every 12 to 8 weeks in horses that are grazing, to assess shedding levels, and treating horses with wormers to reduce egg shedding and contamination onto pasture. And you should consider using the fecal egg count reduction test, ideally in the summer, to test the effectiveness of those anthelmintics, and then be assured that what you're using is working. As I mentioned earlier, you can consider tapeworm testing in the spring and in the autumn to identify horses that maybe have higher burdens of tapeworms, to reduce shedding at the time of year where we go into the optimal activity of the irribated mite intermediate host in the spring and summer, and to test in the autumn to identify those horses that might have higher burdens that might lead to colic. And then in low risk populations of horses, if you want to consider worming those horses but actually don't need to, you can actually use the small red worm blood test just to inform whether or not those horses do indeed have a low level of small red worm burden. And at each phase, when you're discussing wormers, or you're considering worming, or you're considering worm control, always think about assessing the risk that your horse has for worms, which is based on some of the parameters that I mentioned earlier in the webinar. And don't forget to poo pick, because that's a great thing that you can do if you can do it. Maintain a slow stocking density and consider grazing with other animal species. And that's me. Thank you for listening.
Brilliant. Thank you so much, Jacqui. You crammed a huge amount of information into just about half an hour. So well done, and thank you so much. We have had some questions in advance, actually, which I promised the people that couldn't attend themselves live tonight, and obviously very keen to have the recording, but I would ask those questions on their behalf. So Dr. Kieran O'Brien, who's a vet who got in touch before, he asks, is it a myth to wait for the first frost before worming with moxidectin? Any
Yeah,
thoughts on that?
so that's a really good question, and I hear this a lot. And actually, it is, in terms of small redworm treatment, it is a myth. And what you've got to think about, again, it's going back to that risk assessment. So you've got to consider what horses have accumulated over the grazing season, and if they've accumulated a large encysted burden of small redworm, you probably want to go in and hit that probably towards the end of your grazing season, and that could vary between Scotland, the north of Scotland, and down in Cornwall. So again, it's a case-by-case basis. What we would recommend to people is to consider that risk at that time of year, and if you think your horse is at high risk, then you would go in with a larvicidal treatment in the sort of autumn, late autumn, early winter, and don't wait for the frost, because it might never be frosty. And it doesn't really, I think it was wrapped up with something to do with maybe I don't know, bots or something like that, and it's got confusing, because even if you treat horses and the eggs go out and they're deposited, any resistant eggs, for example, they will last in the sort of the conditions that we get here in the winter. It takes quite a lot of real freezing weather below zero to actually kill those worms. So yes, Kieran, you're right, it's a myth.
Brilliant, thank you. I also wanted to ask, there are a few questions and things coming in, but I read your really interesting piece in Trainer magazine about worming the horse in training, because they're not typically turned out very much, which is a whole other topic, and I think Katie is probably going to touch on the kind of pros and cons of some of those repercussions of not turning out. But from your perspective, just for this audience tonight, what would your comments be on horses that are stabled for a long, or a big proportion of their time?
Yeah. Okay. So, I mean, always start with a risk assessment. So your risk is going to say, well, if your horse is in a box or not touching a blade of grass, 100% of the time, then it's going to have little contact with worms. Of course, you always have to consider these little side things that might happen, like if your horse is away and it has a little nibble of grass, or it goes to stay at someone else's if you're on holiday. So they all have to be taken into account. So in that situation, you can say, well, my horse is in a low risk situation, I don't need to treat it. However, if you want to be a bit more scientific and a bit more assured about it, you can apply tests just to confirm that you don't need to treat. So that would be a perfect candidate for doing a fecal egg count test. It's even throughout the year, or the small redworm test, because if you're really concerned about not worming and you want to confirm, that's a very sensitive test that will pick up low burdens with high sensitivity. And of course, you can do the tapeworm test. So those horses, I would say, are perfect candidates for a test-led approach.
And do you find that trainers, even though their horses are stable, do you think that they're still in that habit of just blanket worming across the yard, or are they quite good at using it in a targeted way?
I think, I mean, there's not been that many research publications in the literature about this, but those that have been published in the last 10 or so years have shown that trainers just apply the blanket treatments. We worked with one yard last year. It was really interesting because what we did is we blood sampled them for tapeworm and small redworm, and we expected them to all be really low, because if you looked at the trainer's website, it looked like he did charge for wormer every couple of months. So it looked like they did get interval treatments. So that's one thing. And second of all, we were told they didn't graze. And so when we tested them, it's quite interesting. So about 50% of them were positive in the small redworm test, and about 20, I think less than 20%, maybe less than 10% were positive in the tapeworm test. And we're like, how are these horses getting small redworm? So we went back to the vet and he spoke to the trainer and he goes, oh, of course, I've got the turnout paddock and I turn them out half an hour every day, which was great for their welfare. And we said, well, do you do dung removal of the turnout paddock? Because everybody's going on to that at a certain time of day. No, we don't lift the dung. So it was really good in that situation to go back with a bit of advice and say, well, obviously you are low risk and, a lot of your horses don't need worming, but there were some that did. And that's because of this practice that you do. So keep doing the practice, but you need to get people out with shovels to try and break that life cycle and remove the dung, because obviously it was spreading around and some of them had quite high serum scores. So that was the recommendation that we gave back. And we treated the horses that were positive in both tests with the appropriate wormer. And I'm hoping they might follow up and do bloods this year, but maybe not.
Yeah, well, and it's interesting, and I think there's been a comment in the chat about, I think if I'm reading this rightly, the yard worm every 14 weeks, and I think that is basically the problem, isn't it? Unfortunately, yards just keep blanket worming, so that really isn't okay. That's what we want to try and stop, basically.
Yeah, absolutely, Laura. I mean, that I can see that would probably, so when when Fort Dodge first marketed moxidectin as Equest, because it had this egg reappearance period of 14 weeks, they divided that into a year. They thought, that's great, you can worm 4 times a year, but that's not sustainable, because all you're doing in that population is select, and you're not allowing any parasites to survive that are not exposed to the wormer. And the thing is, I don't know what you're worming with every 14 weeks, Laura. It might not even be working unless you test. So it might be worth, if you can, is speak to the person that's managing the horses and consider them, you know, having a look at our worm risk calculator, or having a look at Canter and just seeing what's available there to make a more informed approach to worming, because that's not sustainable. And you might be missing things as well, because it could be they're not getting the right type of wormer as well if they're not doing a proper risk assessment.
And it is, you know, we can empathise, because it is very hard when you're in a livery yard and, you know, there are rules and things. So yeah, it's a tough one, but there is support out there. So, you know, and work with your vet as well if you can help. They can help you sort of talk to the yard manager and things as well.
Absolutely, yeah.
Okay, well, I think there's some other ones coming in. I think, yes, definitely the underdosing is a big issue. I'm sure. Do you want to comment on that, Jacqui, as well?
Yeah, I'm sure that is a big issue, and that's why I think I mentioned it. Sorry, I went so fast at my talk.
No.
But obviously, if you give a horse not enough wormer, you are more likely to select more worms. I think it's not been proven, like in experiments in horses, because they would be really difficult to do, but there's been quite a lot of work done in sheep worms, which are quite similar, and they show the impact of underdosing on the selection of resistance, where they've actually even got the molecular markers for the resistant genes that are confer resistance to those worm populations. So it's really, really important that people follow the instructions on the wormer and get an accurate idea of weight, ideally on weigh scales. And I know there are people that drive about with scales and weigh horses now, and I'm sure from the nutrition, and maybe Dengie can do that little weigh scale clinics to not just for nutrition but also for worming as well. And some of the weigh tapes I think are quite unreliable. So in an ideal world is get the weight and calculate the full dose and make sure it's swallowed, because I know some horses can be a bit of a nuisance and spit it back out. So it's important to do that as well.
Brilliant. Just a couple more, because they are interesting ones. So we'll perhaps do the gut inflammation one, unless you want to comment on that, Jacqui, but I can type some responses to that one. But do you have any feeling on inflammation and ulcers and the use of wormer?
There's no published literature on the direct impact of wormers on ulceration in the guts. And of course, when wormers are assessed by the regulatory authorities, which is the Veterinary Medicines Directorate in UK, they're assessed for the safety as much as they are as efficacy. So if there had been any issue relating to the development of ulcers, I think the wormers would not have been approved. Now there could be ulcer formation if you're talking about the stomach. There aren't really that many worms of the stomach that are main pathogens in the UK. So even if you have a reaction of a worm against a worm, it's unlikely to affect the stomach. If you're talking about gut inflammation or ulcer formation in the intestine or the large intestine, for example, you're more likely, I think, you will see inflammation, and this has been shown in many studies. If you kill a lot of worms that are in the gut wall, then the response to those dying, because these are great big pathogens, aren't they? They've got lots of antigens on them. The response to the dying or dead worms can cause damage. I mean, sadly, in these horses that already have a big burden, there's already damage there due to the worms, and that may be worsened when you give a wormer, but you don't have much choice because you need to kill the worms. And what some vets will do in those cases where they think a horse is going to be at risk of that is they'll give a sort of anti-inflammatory type steroid to try and dampen down that ulceration. But that's a long way from just the wormers themselves causing ulceration. I don't know if there's any evidence of that.
No. Okay, brilliant. Well, I'm going to ask you, if you don't mind, perhaps answering some of the questions behind the scenes, so I can introduce Katie. And if you are happy to stay around, then if we've got time at the end, we can cover a few more off generally. But I think everyone can see the replies to the questions in the chat box. But thank you very much for that. I'm going to introduce Katie Reeve. So Katie has been with us for just over a year now, and prior to that has worked as a nutritionist for sort of I think 8 or 9 years in total, Katie now. And Katie has a master's degree with distinction, and interesting, someone was talking about the weight bridge and the weight tape differences, and that's exactly what Katie was doing and has published some work on from her master's dissertation. So we're delighted to have her as part of the team, and tonight she's going to focus on sort of gut health and the importance of fibre. So over to you, Katie.
Great, thank you very much, Katie, and thank you once again, Jacqui. That was an amazing presentation, so really, really informative and helpful. So just going to share my screen. Hopefully you can all see that. Is that working all right, Katie?
Yep, all good. Yep.
Yeah. Okay. Brilliant, thank you very much. So yes, as Katie mentioned, we are going to now be moving on to looking at a bit more information on kind of general gut health and other things that we can do alongside appropriate worming management to help support your horse's digestive system. So what are we going to cover? So we'll be looking at the importance of forage and fibre passing through the digestive system, and really kind of building on our Pony Club rules of feeding, which I'm sure a lot of you will be familiar with, but looking at those in a bit more depth and kind of looking at why those rules are as they are really. Also looking at how we're going to choose the right fibre source for the right horse, and what sort of things we need to look at, and how much starch is too much, because I think that's something which is being talked about and kind of it is much more widely known now than perhaps it was a few years ago. So to start off, why is fibre important for the horse's digestive system? So we're all, I'm sure, familiar with the fact the horse is a trickle feeder. They've evolved to spend a large majority of their day eating, and this fibre is really, really important, not only for their digestive health, but also their mental health as well. They've got this kind of psychological and physiological need to be chewing and grazing for most of their time. So that's really the basis of what we're working on when we're looking at the digestive health of the horse. So the horse's digestive system really starts actually at the mouth, which I think a lot of people maybe wouldn't necessarily think of straight away. So we've got our lips, our tongue and our incisors at the front, which are going to be taking food into the mouth. And then as food's pushed towards the back of the mouth, we've got our large molars, which are responsible for breaking down and grinding the feed up into a form that the horse is able to swallow. The amount of chews that the horse is doing is really very much dependent on the type of feed they're consuming. So you're looking at around 3 times the amount of chews needed for hay compared to concentrates, and this could potentially take them around 4 times as long to consume that forage compared to concentrates. Just as a bit of an example, if a horse is fed ad lib hay, they're eating kind of as much as they can, as much as they should be, they might do around 40,000 chews every single day. So it's really not small numbers we're talking about here. And the reason that we're thinking about how many chews we're getting, the reason why it's actually so important is because if we have more chews, we have more saliva, which is then being produced. And this is really what we want to aim for, because saliva contains bicarbonate, which helps to buffer acidity in the stomach. So if we've got more chews going on, we've got more saliva being produced, and therefore we've got that greater buffering capacity in the stomach, which is going to help reduce our acidity and risk of problems such as gastric ulcers. Our high fibre diets can also be really beneficial for the horse in that they encourage much more slower and larger jaw movements and also more even wear on the teeth. This is in contrast to high levels of cereals within the ration. These can potentially increase the risk of problems, dental problems like sharp edges and enamel overgrowths as well. So that high fibre diet really is important right from the get-go. And good dentition is really important for the horse. So the mouth, as I mentioned, the mouth and the teeth are the first part of that digestive system. So if we've got problems here, this is going to then increase the risk of problems much further down the line, which is why it's so important to get their teeth checked regularly and keep an eye on what they're eating. Now, I think poor dental health is maybe a problem which is more commonly associated with older horses, but actually it is a problem that we're seeing more and more with younger horses as well. So things like diastemas, for example, which are basically gaps between the teeth where the food can then get compacted and cause discomfort. There was a study in 2007 which we actually carried out in association with Riddle College, and they found that horses with poor dentition were consuming about 2/3 less in the same time period compared to horses with normal dentition. So to put that into perspective, if a horse is consuming 2 kilograms rather than 6 kilograms of an average hay, their energy intake is potentially going to be around 40 megajoules lower with that sort of quantity. So when we're thinking about horses with poor dentition, we need to bear in mind they might need more time to eat and easier to chew forage so that we can get that forage and that fibre into them. And things like short chops or pelleted fibres are very nice alternatives. And I'll come on to that in a little bit more detail in a moment. We often hear the phrase when we're speaking to horse owners on the feed line or at yards that the horse's teeth are kind of good for their age. But actually, if the horse is old, it doesn't necessarily mean to say that their teeth are still in a perfect condition. So if you have any concerns, there are some certain signs that we can look out for, which might indicate the horse's chewing ability is perhaps not quite what it once was. So for starters, our reduced appetite, our longer eating times, they're often the first signs that we notice. And it's potentially more subtle signs as well. If a horse is turned out in a herd, it can be really difficult to spot if they're not eating as much as they did. If your horse is stabled, we can monitor their consumption a little bit more easily. So you can weigh your forage before you feed it to them, and then weigh what's left to monitor the intake. So you can check they're consuming a suitable amount. Horses out in the field, they might appear to have their heads down eating, but if they're losing weight or they're maybe seeming more lethargic or just not quite seeming themselves, this could indicate they're not getting as much benefit from their fibre as they perhaps should be. And other signs that we see that maybe people might be more familiar with would be things like quidding. So we've got a nice example on the photo there on the screen. The quidding is basically where horses will chew and chew and chew, but they can't break the forage down sufficiently to be able to swallow it, and therefore they'll spit out these fibre balls. If the horse is stabled, it might be easier to spot these fibre balls dotted about, but generally it'd be much harder to identify in the field, especially if there's other horses out with them that might come along and munch on those little fibre balls themselves. And horses with poor dentition may also take longer to consume their forage or their bucket feed, and they might be at an increased risk of choke as well. So if they're trying to swallow food that's not been chewed properly, it's potentially more likely to get lodged in their esophagus. So it's absolutely something we really want to avoid. If they're having problems chewing over a longer period, we'll more likely see weight loss because they're basically not going to be able to extract and utilise those nutrients as efficiently as they would be able to if they were breaking down the forage more efficiently. And another sign, which is, I think, even more difficult to maybe spot, is there's longer pieces of fibre within the droppings. So there's been some research which has suggested fibre lengths of more than 3.6 millimetres could potentially be an indicator of some dental problems within the horse. And a study in donkeys has actually suggested even shorter lengths would be an indicator of a problem, and possibly due to the slightly different anatomy in their jaws. And because donkeys tend to be a bit more stoic than horses, there does become that greater risk of things like impactions becoming much more serious before they're showing other symptoms. So it's definitely important to keep an eye on, and this is another area to monitor if you are concerned. So for horses who can't manage hay or haylage, they often can manage their pasture for a little bit longer. So that's always, or quite often, a nice choice. However, if you're dealing with a horse or pony who is perhaps prone to laminitis, it's not always going to be the best option, especially at times of year when the grass is growing rapidly. For horses who can manage to chew some shorter fibre, these are definitely options, and there's lots of short chopped forage replacement options available, so things including ingredients such as chopped alfalfa, grass and straw, and these can be used as potentially partial or complete forage replacers depending on the product in question. Some horses will struggle even with the chopped fibre if their teeth are really quite bad. So for them, using a product which can be soaked will be even easier to manage. So pelleted fibres like grass or alfalfa pellets, sugar beets, these are really nice high fibre options which can be soaked to make a nice easy to eat mash. Now, our session this evening is, of course, not just on dental problems. So if you would like to find out more information on this, we do have a webinar specifically on feeding and managing the older horse, which is on our YouTube channel. So from the mouth, our food is going to pass down the esophagus and into the stomach. The stomach has quite a rigid structure, so it's really not great at accommodating large meals. And this is where that sort of saying, feeding little and often, comes from. We want to make sure those meal sizes are really nice and manageable for our horses. Food's generally going to stay in the stomach for about 20 minutes, but if we're feeding almost continuously, if a horse is eating and grazing like they have evolved to be, the stomach is actually very rarely going to be fully empty. We have our acid and our enzymes, which are going to be produced in the lower half of the stomach, so the glandular region, which is shown on the screen in the sort of darker shade. I'm not sure if you can see my mouse, this little area here. And this acid is going to be produced pretty well continuously in that area. So this is not really a gastric ulcer presentation, but I didn't feel we could have a talk about digestive health without at least touching on gastric ulcers. So there's lots of different factors which can contribute towards gastric ulcers or gastric disease in the horse. I think it's something that researchers are still very much looking into. But in the context of forage, it's been suggested that more than 6 hours without forage can really quite significantly increase the risk of gastric ulcers. And if feed and forage is being withheld for many hours, that the pH of our gastric contents can really drop to quite low levels, in the region of 1.5 to 2. Normally the pH in the stomach is somewhere between a 2 and a 4, depending on the area. And the lower the pH, the more acidic it is. So that lower number is demonstrating we've got a higher level of acidity in that area. And there's a few things that we can think about when we're looking to reduce the risk of gastric ulcers in our horses. So as I mentioned earlier, encouraging lots of chewing, feeding plenty of fibre can really increase that saliva production and therefore aid in acid buffering capacity. So that's one of the main reasons why forage is so important. But fibre can also act as a physical barrier, which is going to protect the squamous region of the stomach from acid damage. So it's going to block that acid from coming into contact with the squamous epithelium in that top part of the stomach. If we're looking specifically at our squamous gastric disease or our ESGD, high levels of starch can also increase that risk of ulcers occurring. And then when it comes to the EGGD in the lower part of the stomach, things like stress, as Katie mentioned with the turnout, different management practices are all thought to play a really big role when it comes to that glandular gastric disease. So this is, as I mentioned, very much a whistle-stop tour of gastric ulcers. If you would like to find out more, Katie did a really great webinar with Dr. Michael Hewitson from the RBC a few months ago, and that recording is also on our YouTube channel. So next up, we've got our small intestine. So this actually gets its name from its small diameter, which is about the length roughly of a credit card, give or take, rather than its length, because it's actually about 21 to 25 meters long, which is about 2 double-decker buses in length, just to give that some context. So it's pretty long, but food actually passes through really quite quickly. Relatively speaking, it can take around 45 to 60 minutes to pass through. And there's lots of nutrient breakdown and absorption, which is occurring here. So things like our fats and oils, our proteins, our sugars and starches, and our vitamins and minerals as well. So it's a really important part of the horse's digestive system. So to help in this absorption capacity, the small intestine is lined with millions and millions of these little hair-like structures, which are called villi. And these really increase the surface area for absorption. This is their function. And if you were to roll out the horse's villi from the whole of their small intestine, if you were to roll it out flat, it's going to give you an absorption surface area of about 3 tennis courts in size. So it's a really, really large area relative to the size of the horse. There is some research to suggest that if we're feeding very high starch diets, this is going to potentially create more acidity in the gut, and that absorption capacity or the size of the villi can then be reduced. And this means that that absorption capacity is not going to be as high. The horse is not going to be able to extract as much benefit from the feed that's passing through the small intestine. So really, when we're thinking about the context of starch in the diet, less is very much more. Even when we're dealing with a poor do or an underweight horse or pony, if we can avoid turning to high levels of cereals, those traditional conditioning mixes or cubes, that's probably going to be a better way of going about it. So things like using fibre, oil, are all going to be much more sympathetic to the digestive system and much more likely to help maintain that nice absorption capacity within the gut. And if you are interested in finding out a little bit more about how much starch is going into your horse's feed, we've got a really handy starch calculator on our website. I've just popped the link on the screen there. You just need to enter your horse's body weight, the percentage of starch that's in their feed, and the amount that you're feeding, and it will give you a nice little answer very quickly of whether you're feeding a suitable amount of starch or whether you're perhaps feeding a little bit too much. So that's a really good guideline if you are interested to find out more there. So from our small intestine, we then move on to the hindgut. And this comprises of the cecum, the large colon and the small colon, and they all have quite similar roles. So we tend to talk about them quite collectively as the hindgut. And in this area, the biggest thing which is happening is that our fibres being broken down by microbial fermentation. So we've got lots and lots of microbes in the gut which help to digest that fibre and basically convert it into a form of energy that the horse is able to use or to store. And as well as the digestion of fibre, there's a few other things that can occur in the hindgut as a result of this process. So when these bugs or these microbes are breaking down the fibre in the gut, they're also going to be producing B vitamins, so things like biotin. And a lot of you might be familiar with using a biotin supplement, potentially if your horse's hooves aren't in the best quality. And while this can be helpful, it shouldn't really be forgotten that if we're feeding enough fibre, we're feeding enough forage, this is always going to then increase the amount of B vitamins that are being produced in the horse's gut naturally themselves. So that's something else that's really, really important if you have got a horse with maybe poor hoof quality or who just needs a little bit more support, is start with the fibre. That's going to help. We also have heat being produced as a byproduct of fibre fermentation. So this is basically like your horse's own central heating system. It's going to help to keep them warm. The more fibres being fermented, the more heat that will be produced. So over the winter months, if you do have a horse or pony who's maybe feels the cold a little bit more, making sure they've got plenty of forage is again a good place to start. And finally, fibre helps to push gas out of the digestive system as well. It helps to keep everything moving nicely and keep that pushing through. And there's lots of problems, though, that can, however, go wrong within the hindgut. One of these, which many of you will be familiar with, is that sudden changes in the diet and also an overflow of starch from the small intestine can essentially cause a disruption to the population of the microbes in the gut, and this is known as dysbiosis. And this can show symptoms such as colic, we might have loose droppings, or we might even get laminitis. So there's lots of reasons why we want to feed that little and often, keep our meal sizes small, just to reduce that risk. And we also want to be making our dietary changes very gradually over a couple of weeks as well. The microbes in the gut are all very much adapted to the diet that the horse is used to having. And if you change that diet very suddenly, they go into a bit of a panic mode and they're not very good at coping with change. So we want to make sure we're making those changes very, very slowly to give them time to adapt to that change in diet. And even if there's no obvious signs, you're not seeing that colic, you're not seeing loose droppings, but your horse is losing weight, then supporting digestive health is only going to still be a good thing, because we might still have some level of dysbiosis that's going on. So feeding plenty of forage, not only to provide more energy or calories for your horse, but also just to support that digestive health and help your horse get the most benefit from its forage. Something else which is really relevant within the horse's hindgut in the context of fibre digestion is the role of mucus. So the horse's colon basically has a mucus barrier really lining the inside of the gut, and this helps to protect the cells of the gut, which are called colonocytes. Now these cells are continuously producing mucus, and these help to keep the barrier intact as it can be used by the bacteria as a bit of an energy source. If we don't have enough fibre passing through the gut, then the bacteria need to get more energy from the mucus. And so the mucus barrier starts to become eroded to a greater extent, as it can't be replenished quite as quickly as it's being used. And if we have a greater erosion of that mucus layer, this means the gut can start to become more permeable, permeable to pathogens and leaky. So this is when we get things that perhaps shouldn't be able to escape from the gut start to be able to do so. So pathogens that can escape out of the gut into the body through these joins of these cells, which start to become compromised, have little gaps in, and they can get out and cause what's known as leaky gut syndrome. So these horses who are suffering from leaky gut syndrome might have a compromised immune system. They might just become all round a little bit less healthy. We sometimes see this in the case of the older horse who's perhaps not consuming enough forage or as much fibre, and so their digestive function, and they might then be at a greater risk of illness and problems going on there. And fibre is also really important from the point of view of the lymphatic system of the horse, because it helps to move our lymph through the horse's body. So you might be familiar with the fact that physical movement's really important in the process of keeping that lymph moving, reducing the risk of filled legs. So if the horse is stood in for long periods, we tend to hear about it more over the winter months, or for horses who are on box rest, we hear more about these filled legs where that lymph is basically accumulating. And relative to the human, the horse has actually got quite a high number of lymph nodes, so about 13 times the amount, and half of these are located within the horse's gut. They basically work when the digestive system is pushing food or pushing fibre through the gut, through these muscular contractions, keeping everything moving. And this is a process which is known as peristalsis. If we haven't got as much peristalsis occurring, then everything becomes much more congested, and those filled or those swollen legs become much more likely. So if your horse is standing in for long periods, providing plenty of forage can also help reduce the risk of that as well. And our final part of the digestive system, moving on, is our rectum. So this is about 30 centimetres long. And what comes out of our rectum can be a really good indicator of the horse's digestive health and actually what's going on inside. So monitoring things like the amount of droppings you're getting, what they look like, what they smell like, have we got these long pieces of fibre in the droppings, can all give you an indication of if there is some sort of problem that's happening internally, whether that's literally internally in the digestive tract, or whether that's up in the mouth and with the teeth. And we do also hear about a problem called free fecal water syndrome, which seems to becoming more and more common, I would say, over the last few years. And this can be associated again with insufficient fibre within the diet. It's something that free fecal water is still something we don't quite know everything about just yet. It's basically where the horse produces normal droppings, but we get some kind of liquid afterwards. So if you are seeing this in your horse, it could be that there's some kind of problem going on, whether that's with their chewing ability or how well they're digesting their forage. So when we're talking about fibre in the context as a nutrient, we don't actually know as an industry or within the research how much fibre a horse needs, but we do know how much forage they need. So generally the recommended guideline from most nutritionists nowadays would be around 1.5% of the horse's body weight on a dry matter basis. There was a study which was done about 14 or 15 years ago now, which restricted forage to 1% of body weight on a dry matter basis. And they found in their study that this low level helped with weight loss, but didn't have any adverse effects on the horse's welfare, which is great. However, when you actually look at the study, they based the measurement of welfare on the horse's behaviour, so how well the horse was, kind of what they were doing, whether they were eating or resting, but they didn't actually look at the horse's digestive health. They didn't look at things like gastric ulcers, for example. And the study was also really quite a short-term study, relatively speaking. So from everything that we've kind of covered so far this evening, actually we know that digestive health really does have a big role to play when it comes to welfare. It's not just about their behaviour. So with more recent work that's been done, I think most people, most nutritionists would very much agree on that 1.5% is a good amount as a minimum these days. We do very, very occasionally in acute scenarios, so things like where the horse has severe laminitis, or they're really just not losing weight, we might need to go lower than that for a short-term basis, but we wouldn't tend to recommend doing this for longer than about 12 weeks, and only with veterinary supervision, always with that aim to return to that 1.5% of the horse's body weight. So really, when we're dealing with these overweight horses, we want to be aiming for more chews, but for fewer calories. So we want to have enough fibre going through, but keep that fibre as low in calories as we possibly can. And one really nice way to do this is to dilute the forage that you've got with straw. Now, this is something which we've kind of learnt about a bit more about in recent years, and the research is now suggesting that up to 50% of the horse's forage ration can be replaced with straw. If you were to replace even just a third, which was the previous kind of recommended amount of an average hay ration with straw, you would get about a 16% reduction in energy or calories, depending on the quality of the forage being reduced. It's quite interesting that the NRC, which is our sort of nutritionist gold standard reference text, nutrient requirements of horses, they suggest to change 0.5 of a unit on our 0 to 5 body condition score scale would require a reduction in our horse's energy intake of about 11 to 15% of the total diet. So straight away, even if we've only replaced a third of the forage ration with straw, we've already got that 16%. So in theory, sufficient to help to sort of promote that drop in 0.5 of a body condition score scale. And if, of course, if you're replacing up to 50% of an even better quality forage with straw, then your calorie or energy reduction will be reduced to an even greater extent. And straw is also really useful in that it takes the horse longer to eat, generally speaking, than hay. It can be mixed into the hay net, so you don't need to feed a net of hay and a net of straw. They can all be mixed in together. And this can be a really useful way to slow down those really greedy horses. Even if a horse doesn't like straw that much, but you can mix it into the hay, it's not necessarily going to be wasted, because it still might help to slow them down, because they've got that kind of sorting behaviour that they have to go through to sort out the tasty bits that they like. So it's a great way to slow them down. You can get short chops of straw, which are available from the bucket, or blends of chopped fibres which contain straw, and these can be really useful if you perhaps can't source straw, if that's difficult, if you've not got the storage at your yard. You can feed these low-calorie chopped fibres in separate buckets as even to replace 1 to 2 kilograms of your hay ration per day, just to help give your horse a little bit more variety firstly, and give them that lower calorie alternative to their hay or haylage. And the only caution I would have with straw is that if you have a horse who potentially has a history of impaction colic or dental problems, it would be advisable just to have a quick chat with your vet before you introduce it, because what we don't want to be doing is having any more problems there. But for the kind of average healthy horse, straw is a really nice choice. And so more generally, and not specifically for the overweight horse, a question we are often asked here at Dengie is what type of forage is going to be best for different horses? And there's a few different factors which can influence what we recommend here. So firstly, the type of the plant, the type of forage is going to be our first question. So as I mentioned previously, we've got our straw as a good option for our good doers or our overweight horses. The plant species is also relevant to consider, especially when we're looking at our horses who may be prone to laminitis. The species of plant can affect the sugar levels, but it's not the only consideration. There's lots of other things that can also affect the sugar levels of a plant. Timothy grass tends to be lower in sugar than ryegrass, but it's not always the case. And if you have a Timothy grass that's maybe cut under certain conditions, you might get one which is higher in sugar, than a ryegrass, which is maybe cut a little bit later in the season. And the timing of when you're cutting your forage is also really relevant when it comes to its quality. So as the plant is growing taller, it's going to need more structure to hold it up. And that structural bit, so those thick cell walls in the plant, they're the bit which is going to be least digestible for the horse and kind of take a bit more breaking down involved. So the older the plant is, the more fibrous it tends to be. A more mature forage, if you're not sure when it's cut, generally a more mature forage will feel a lot more coarse and more stalky when you're in your hand compared to a forage which is perhaps more soft and leafier. Those types might be potentially a little bit younger when they were cut. And it is worth remembering, if you want something late cut, remember to specify that you want a first cut in August, as this will be more mature than a second cut in August. So make sure you're being very specific if you are requesting this from your supplier. And weather conditions can also play a role. So as a general rule, our longer and brighter summers, although we didn't actually really have that much this year, certainly in this area, but if we do have this very hot weather, these will be giving us, generally speaking, higher levels of sugar, because if we've got more sunlight, this will mean the plant is photosynthesizing to a greater extent and therefore producing higher levels of sugar. And the timing of cutting, on that same sort of note, is relevant as well. Plants use their sugar, they use up their sugar in the dark and they make sugar in the daylight. So if you can cut early in the day, first thing in the morning, ideally, this is going to be the best option if you want to keep your sugar level as low as we can, because the plant won't then had a kind of whole day of photosynthesizing and sugar making ahead of it, compared to if you were cutting later in the afternoon or early evening. So there's a lot of factors here which can affect the quality of the forage, and this is really why analysis of your forage can be so important, and especially if you are dealing with a horse with insulin dysregulation. So for example, horses with equine metabolic syndrome, EMS, or those who are very prone to laminitis. So an analysis can be really helpful, so you have a better idea then of what your forage is providing. And so, as well as feeding plenty of fibre, something else that can be really beneficial to support the horse's digestive health is to include the use of a digestive aid supplement. And there are a few different types of these available. So the first type is probiotics. Now, by definition, these are alive bacteria, but actually there are none of these approved for use in the horses. So if you see any supplements or feed advertising that they contain probiotics, this will usually refer to live yeast rather than bacterial probiotics. Prebiotics is another one which is often included in feeds, and often it's our FRSE prebiotics. These really act as a food source for the good bacteria in the gut, and they help these good bacteria to flourish at the expense of our more pathogenic or harmful bacterial species. You can also get MOS prebiotics, and these attach to harmful bacteria within the gut and help to remove them, which basically helps to prevent them from becoming established and causing all sorts of problems. And postbiotics, they're a much newer inclusion in horse feed. They've only really been around for the last couple of years in the horse feed industry anyway. They're produced synthetically through the fermentation of live yeast. So essentially they're dead yeast plus their metabolites. In human nutrition, things like kefir, live yogurt, they're going to be doing very much the same sort of thing as postbiotics for horses. And then finally, we've got our live yeast, which is really part of the fibre digestion process. And there's a really good amount of evidence in the horse that live yeast can be really beneficial for improving fibre digestion and helping your horse to make the most efficient use of their fibre. So really good options to look at if you have got a horse who's potentially more sensitive to change or is maybe prone to colic, that free fecal water, any sort of digestive issue, even if they're underweight, a digestive aid supplement can be really very beneficial for them. So that brings my part of the presentation this evening to a close. If you would like more information, as I mentioned, we've got our webinar recordings on the YouTube channel, and you can also contact our nutrition team here at Dengie for feed advice and a tailored diet plan for your horse, and we're happy to talk through any concerns that you've got for your horse, and advise on the best options for them. And more than happy to answer any questions that you've got. Thank you very much.
Well, and Katie, that's really interesting. We had one question come in about the use of straw, which I've answered in the chat box, but let's have a look, see what else has come up. How to go about using or choosing even a useful gut supplement. Are there any that are more highly recommended than others? Do you have any thoughts on that you want to share?
Yeah, that's a really good question. I think to an extent, it almost depends a little bit on the horse. I would tend to try and choose one which includes some of the ingredients that I mentioned on the slide. They're going to be the really key things to look out for. And trying some different ones. So sometimes what works for one horse might not always work for others. So, but those are the good ingredients to look out for. You can also look out for feeds. A lot of concentrate feeds or fiber feeds will contain these sorts of ingredients these days as well. So if you have any sort of specific questions for your horse or any problems you're concerned about, then just let us know. We're more than happy to help you separately afterwards.
Yeah, I think a key point with the gut supplements where it can cause confusion in terms of trying to determine quality is the feeding rate plus the sort of, particularly in the case of live yeast, things like the colony forming units. So if anyone is perplexed as to comparing and contrasting and doing the number crunching, because there's a lot of zeros
yes, absolutely
involved, then we're more than happy to help on the feed line and get our calculators out. There was another good question about whether Speedy Beet's any good to feed to keep weight on in winter. What are your thoughts on that, Katie?
Yeah, it could be a really useful ingredient. So Speedy Beet is just unmolasses sugar beet. There are other brands available, but that's one I know a lot of people have heard about. And that's a really good, easily digestible source of fibre for the horse. So certainly can be a useful addition to their diet, absolutely. But it will depend a little bit on your horse in terms of what's going to be the best option. We need to look at the whole diet rather than just necessarily adding in certain products. It's kind of optimizing the whole ration rather than just adding one or two things. But yes, it, as a general rule, Speedy Beet is great.
Fabulous, thank you. Not sure if there's any more. Lots of thank yous coming in. Here's Jacqui. Jacqui, were there any comments and from the questions that you were kindly answering behind the scenes that you just wanted to make as general points for everyone?
No, I don't think so, Katie. I think that the questions were quite specific, so I don't think there was anything. There was just the one about buying Equisal, so you can obviously you can get that directly from us, from our website, as I clicked. But also as well, it's quite good to I guess buy it in contact from either your SQP provider or your vet, because if they can get the result, then they can help with the advice for your worming, depending on the result of the test. So I just wanted to add that in. But I don't think there was anything else. If anyone's got any questions, they can always email us at ADB as well.
Yeah, and I just wanted to sort of reiterate that the webinar is being recorded, so Jacqui's very kindly said we can share it, and there will be a email message coming out if you've obviously registered because you're watching this, so you'll get all of that, and then it will be available more widely on our YouTube channel as well. So we're very grateful to you, Jacqui, for that, and that is very much appreciated. Katie, do you want to answer Jackie's question about how, gosh, a 40-plus-year-old pony, lots of
Brilliant.
Our veteran here was advised to just give vegetable oil to help with weight. Is that the best thing to do for her? Any thoughts immediately, or we can follow up because we can have Jackie's contacts.
Yeah, so we're more than happy to kind of have a chat with you, Jacqui, in a bit more detail there. I think there's possibly a few other
Could be
things
more
to
to
think
question.
about there. I mean, vegetable oil certainly can be useful. It's essentially just fat, so it is a good way to add some concentrated calories without significantly increasing the volume. I think particularly for your pony, who by the sounds of it is on quite a lot of bucket feed or forage replacement at the moment anyway. But the main thing I really often recommend and reiterate for horses who are very old and dealing with those sorts of dental problems is that we really want to make sure we're feeding the right amount and enough of our forage replacement feeds. I think a lot of the time, because it's fed in a bucket, it looks like a huge volume, but actually when we break it down and look at the weight or the dry weight of the feed that we're giving as our forage replacement and how that would compare to the amount of forage that the horse would eat back in their younger days, sometimes they don't always tally up. So that's another thing which I'd always kind of go back to and just make sure that that's right as well. But yes, we can certainly have a chat with you, Jacqui, if you'd be interested in a bit more detail there and go through things in a bit more detail with you.
Yeah, and we have lots of great examples of case studies where we've kept horses going into their 40s plus with very poor dentition, because we've just got to give them something they can manage. So age is no barrier. We can get fibre in. Well, I'm going to do the thank yous. I know, Katie, you sort of kicked everything off, but I'm going to round up by just saying thank you to Katie and particularly Jacqui for giving up her evening this evening, and wider than that, all the work you're doing in terms of developing the tests, spreading awareness of this really key important issue. So thank you. We really value you sharing all your information and expertise with us this evening. And thank you, Katie, for organising the webinar. I know you've done a lot of work behind the scenes, so that's very much appreciated too. So yeah, thank you to everyone for joining us. As I say, the recording will be coming out to you via a link. Check out our YouTube in case your email goes into spam, but if you go to our YouTube channel, it will be there in due course. But thank you very much, and good evening.
And thank you, Jacqui.
Thanks, everyone. Good night and take care.
Take care. Bye-bye.
Bye. Bye.